My name is Dr. David Conversi. I'd like to share with you the effects or the effectiveness of our spinal decompression therapy in reducing a disc bulge or disc herniation with regards to pain. Now, there's three main things that we're looking at as far as that can cause pain or pain generators when we're referring to a disc bulge or disc herniation. The first one is the disc actually itself. The fibers or the outer wrapping of that disc has a lot of nerve endings or pain sensitives in those areas, and if that area is being pushed or herniated out, that sensitivity is going to increase, and we're going to have pain associated with that disc bulging. The second thing we're going to have problems with is when that disc actually bulges out. A lot of times it'll push into the spinal canal where we're going to have our spinal nerves. Now that in itself can cause pain in that area, but a lot of times we'll also see pain that will go down into the legs. We'll have numbness and tingling going on into the legs, and we'll also even at some severe cases have a weakness in those muscles down in the legs and feet as well. The last pain generator that we're going to be talking about is the joints themselves. So when that disc decreases in space or is basically bulging out in a particular area, what that does is it causes increased pressure on the joints on the bones above and below that disc. Now, in between those joints, they're basically called facet joints. The space in between those joints are very highly innervated, so they're very sensitive to pressure. So with that increased pressure, we're going to have increased pain in that area. So now that we've explained a little bit about the pain generators, let's talk about the therapy itself. With the therapy itself, what we do is we strap you to a table, or we have you laying flat on a table, and we'll secure the lower part of your body and also the upper part of your body. And what that table will do is it's going to help decrease or distract those two bones away from each other. So the first thing it'll do is it's going to help reposition that disc bulge or disc herniation back to where it needs to be. So it's going to effectively eliminate the pain associated with that disc bulge or those fibers on the disc itself. The second thing that it'll do if we reduce that disc bulge is not going to be pressing in on those spinal nerves anymore, thus effectively reducing the amount of pain and symptoms that we're experiencing down into those legs. And lastly, what that therapy will do is it's going to basically have that decompression, or it's going to take that pressure off of those joints that we had in our back. Again, those facet joints, when they're being pressed or compressed on, that sensitivity or the pain generated from that is going to be effectively reduced with that distraction. And in addition to the distraction on that table, the table also ever so slightly flexes down, which enhances the therapeutic effect of our decompression therapy. So if you think you're experiencing the pain or symptoms associated with a disc bulge or a disc herniation, we'd love to help. Give our office a call at 618-519-9334.